Matthew Holt with the Healthcare Blog, another THCV Spotlight. This is Patty Hayward. She's the General Manager for Healthcare and Life Sciences at Talkdesk. And what you're all asking is, who is Talkdesk and what do they do? So, Patty, who is Talkdesk and what do you guys do?
Well, thanks for having me, first of
Of
all.
course.
Appreciate the time. Talkdesk is a contact center vendor, but what we really look at doing is how can we improve the patient, member, consumer with experience across healthcare.
All right. Well, that's a good idea. I think most people would think that we should be doing a better job at managing that. But I mean, so contact centers and cloud contacts and the stuff that you work in, this is all those people when you call some health plan somewhere or some provider or somebody, there's eventually you get somebody on the phone, or you might not get somebody on the phone. You might get a computer on the phone. So can you explain a bit about the market for that, where that lives, where it goes, and then what specifically TalkDesk does?
Yeah. So really it's any form of communication. So I know traditionally we always think of contact center as just phone, but obviously there's a very digital presence now because people want to be able to have conversations across multiple different channels. I know my daughter still won't call me. So, we want to be able to meet those folks where they are. So really, when you think about contact center, you're thinking about all of those different channels and all of the communications you have, whether it's with your patients, whether it's with a member if you're a health plan, whether it's with physicians. We work with a lot of life sciences companies as well. So there's a lot, anybody who's trying to contact you and have conversations, we power those interactions.
Okay. So are you in the business of, are you a tech company or a tech company and a service supplier? Do you have human beings who work for Talkdesk who are in contact centers? Let's say I want to have a
Question.
contact, spin up a contact center for whatever my
Yeah.
new drug or my health plan or whatever. Do you
Right.
supply the whole thing or are you just a tech only services company? Tech only company, sorry.
We are the tech provider. We do
Okay.
work with a lot of BPOs. Those are those folks that power and give you guys sort of outsourced humans that can do
Hmm?
the spin ups of those contact centers. We work with a lot of those, but we are the tech stack that powers
Right.
those.
So let's talk about the tech stack. As you said, there is, I mean, I have no idea if they're customers or not. I've gone from Blue Cross Massachusetts lately to Blue Shield. Blue Cross of Massachusetts had a actual like a chat, an IM intimate chat function on their website, which occasionally would answer. Sometimes it wouldn't. Sometimes there you find people who start that with a bot, which you have to get to a human relatively quickly. Sometimes the bots are getting smarter. We see that, and then often there are. Now I'm with Blue Shield of California. Don't have any of that. You have to call a number and wait on hold forever to get to somebody to answer something which you think could be done fairly easily via a message machine. I have a similar experience, by the way, with my banks. I have drives me nuts that Bank America can't answer a simple email, but that's by the by. Give me a flavor of where healthcare is, in this
Yeah.
transition between the different modes that we discussed.
Yeah. I would say in general, and some are obviously further along than others. In general, we're at the beginning of that journey, right? A lot of folks are still even in the on-prem world. They haven't gone to the cloud. And it makes it harder to evolve to some of those more digital aspects. Others are sort of bolting on individual vendors and what I call building Frankenstein and having a bunch of different vendors that do a bunch of different things, which also can make the experience a little bit more chunky because the conversation doesn't flow into the next channel if you have to escalate from, say, a chat to a phone call. So, in an ideal scenario, you want someone to be able to understand everything that happened before, so you don't have to keep repeating yourself. That's a really big thing. So synchronization across channels, and you want the ability to have recordings for everything and all of those different aspects of that. So what I would say is healthcare is very much early in their adoption of these new tools. There are some organizations that are much more further along in innovation centers. But so that is, are you hearing this? Are you hearing my dog?
No, no,
No,
keep going.
great. Sorry, I apologize. We
No,
can.
just start that sentence again. Just start again when you said healthcare was what I wrote.
Okay.
It's cut out.
So healthcare is very much at the beginning of their journey. So they're trying to adopt these new technologies to allow them to really meet patients in better ways. They're also trying to deal with the amount of volume that they have calling. so that you don't have these long wait times just to get a simple answer. Because as much as we push people towards digital tools, the complexity of healthcare is pretty high. So people are going to still call. And there's just a lot of processes and procedures that really need to evolve to also meet the new technology and to be able to take advantage of it. So as great as some of these bots are and have the capability to do things like scheduling, rescheduling appointments, which seems kind of simple, in healthcare, we've made it really complex. So those decision trees that you need to go through can oftentimes preclude being able to schedule them with remote and automation. So that kind of takes away that 24/7 capability. They only have sort of that traditional 8 to 5 type of contact center. And so the experience can be a little hit or miss. And then layer on top of that, just access issues that healthcare is going through right now, where even if you do get to someone in a reasonable amount of time, there may not be appointments to schedule into. And that's just because we have a shortage of physicians.
So that's one aspect, right, which is the different levels of technologies. And you said mentioned Frankenstein monsters, different vendors. We're also trying to do more in that kind of digital front door, right? So you're saying now symptom checkers, as you mentioned, are sometimes becoming appointment pieces. You may have a symptom checking tool from a different company, presumably than from a Talkdesk. You may have appointments, different appointment setting vendors and all the rest of it. Are you in the business of that systems integration? Are you trying to build out all those different ranges of tools, or how does this work? If I'm now sitting in, if I'm in a health plan, I'm saying I've got to make my customer experience better. I'm the guy at Blue Shield who's pissed off that Matthew's on Twitter complaining about what I just went through. How do I think about bringing all that stuff together and the different things that I could do, given that there probably wasn't such a big symptom checking and steering me to the right doctor and whatever that probably didn't exist 10 years ago.
Yeah. So let me pivot over. You mentioned the payers, but let me just pivot to the provider real quick, because we've spent a lot of time working with Epic. Epic is a workshop. One of our key partners, we are in their workshop, and we spend a lot of time co-innovating and really thinking deeply about how we can make these interactions better, more seamless, and have less of these additional bolt-on pieces to be able to accomplish the types of things that you're talking about. So in a case like that, you're talking about really two main vendors that can do most things, right? You have this ability to really keep your system of record, which in the case of a provider is going to be the EHR, right? You want all that information to stay in that EHR so that if you have an appointment, you go in, you can see the things that had occurred as a provider, as a healthcare professional, of what transpired with those discussions. You want all of that to be available on the record, with the ability to summarize and give you next best actions to agents and things like that. So it's important to have really deep integration points and allow the feeding to those agents of those next best actions and things. It's also really important for us to go beyond just the ask answer typical contact center. So as you think about contact center, the way they sit today, typically when someone calls in, they have a question. Our entire focus is to put everything onto the patient. They need to go figure out who they have an appointment with, when, what are they supposed to do next? What are the things that they're going to do? We may have handed them a piece of paper, but it's all on them, which is a difficult thing. Even myself, who's working with, some of my family members right now on health events that I need to help them navigate because they're not able to navigate it well, it's difficult. So what we need to do is we need to start really understanding who our patients are when they call in, be able to identify them, obviously, to secure the PHI. But once that happens, we need to be able to help guide them in an easy way. We need to be able to give next best actions to that agent for that patient or that family member to help that patient do. And make sure it's not just the, hey, I need to refill this prescription that I'm out of at the pharmacy. Well, okay, I see that you need that, but I also know that you're a diabetic and I need you to go get your A1C check because it's been 18 months. I need you to come in for an appointment. I need you to get your annual mammogram or whatever it is that you need to do. Let's make those appointments right now while you've called in. That precludes the person having to call back in multiple times because now they've realized in order to do X, Y, Z, they're going to call in and do different things. And it also helps with giving these agents more deep responsibility for helping our patients navigate, which allows us to train up and give a career path for these agents. Because today, the career path is you either become a manager or you leave and you go to a different one and you get more pay or whatever. You go do something completely different. There's not really a career and a professional path. And it takes so long to get these agents up to speed, right? I mean, I've talked to one organization where they won't even let them take a phone call by themselves for 3 months. And then the average tenure is 18 months. That's tough, right? It's
Right.
because of all the things that are going on. So in my viewpoint and the things that we're working together to do, it's, while contact center is, an important thing, it's really how do we solve, the greater problem of basically helping people navigate their health better, which leads to a couple of different things. Healthcare is on a course for obviously a lot of value-based care contracts. So if we understand what those metrics are, which is typically what it also takes for patients to stay healthy, let's have them do those things proactively, less call volume, more satisfaction, and better interactions all around. So it's a complete kind of change around how we even think about contact center. And that works as well for the payer organizations. I think payers further along because they are the ones who obviously pay the bills. So they're much more interested in these care-based, value-based care metrics and making sure people are doing the right things for their health. But we can even do better with more proactive interactions there too, not just outbound, but when people call in, making sure that we can arm agents with the same sorts of things.
So you're talking really about taking the technology that you have and putting a lot more information in it at the front, sort of the connection point with the consumer. A lot of those things you talk about are sort of semi-clinical. We need certain things and we can talk to you about it and line it up and get more information, which is both about delivering information and also sort of changing the role of people in the contact centers or wherever they are touching the humans. There is one aspect though, which is tricky, right? Which is that there's still, and I've been talking about this for a long time, there's still kind of a battle for who actually, quote unquote, owns the patient, right? So is it a health plan? Is it their primary care doc? Is it a bigger health system? Is it an employer? Each of those have people. There's a number there'll be a number on the back of your card to call. You might have a number for your doctor. You might have. I mean, I have this just between One Medical and Blue Shield. I don't have an employer, but there are plenty of people who have Accolade or now Transparent or whatever one of these companies. So to some extent, I guess the question is, you've made obviously a pretty big bet about the relationship with Epic, and that covers a lot of providers. But where else how do you think about, how do you see that kind of, quote unquote, is managing that patient experience? Right. Where do you think that ends up?
Yeah, I mean, I think that it depends on where the patient is in their journey, right? So if you think about, and it's funny you ask this because I've just been working on the journey maps for thinking about consumers, right? Who really, when you think about people, you and me, we're consumers until we're inside the four walls of the institution, and then we become patients. Mm-hmm. So if you think about that consumer journey, it's important to think about where all those touch points are and what you should be doing at those different times. And you're right, there's a difference in who owns the data depending on where they are in their journey. So it's important for a company like Talkdesk to be, obviously we've made a big bet with Epic, but we've also made equal bets with Salesforce, ServiceNow, different groups like that, because outside of providers, other CRMs, right? Customer relationship management software that owns the data, you need to be able to access all that data in real time for them as well, which we can do as well. So it's important, though, to be able to also link to knowledge base, because if you talk to most of these complex institutions, even if they have a Salesforce or a Microsoft or any of these other CRMs, they've also built all of these other different data repositories that all have to kind of feed, and everything lives in different places. So I think the AI layer is going to be really, really important, and the data repository is going to be really important. And how do we get to a point where we can listen to the conversations, we can data dip into the knowledge management area where the information we want these agents to be able to deliver lives, and bring that up in bites that an agent can then deliver. Not a full article that they have to read because that's useless. you need to be able to give them bits and bytes about these are the things that you should be doing next. These are the questions you should be asking next. Here's the direction you should be pointing them in next. And that is all becoming very AI driven and very much what we call our co-pilot, right? To be able to help those agents do things in the right way. And that's a crucial next step in the evolution of where contact centers going.
Yeah, I'm very interested in meeting the first company that doesn't describe AI as their co-pilot. But that's I've got a lot. Kind of
I
kidding.
kind of look at
Oh,
that
I was.
now.
Sorry,
It's so funny. It's not even a name of a product. It's more of like I look at it, and everybody names it that, by the way. But like, because you're right. But it's more of like a class of things which
and I know where people go
but
there.
you're right. Everybody has now
It's getting overused. But anyway, but let
100%.
me. You actually hit on something. I was with a really early stage startup yesterday who was showing me, their ability to dip into different knowledge bases within LLMs and reproduce it back out and build new templates and what have you. You've hit on something very interesting there, right? Which is that we've got all this different data led in different places across different silos within the same institution organization, also within different organizations. And there's a parallel conversation here about medical data and Kafka and moving that around, and which you hear a lot when we were at HIMSS and at Health and elsewhere. But then you've got the piece which is, okay, we're going to AI enable the human, and then we've got the piece which is we're going to get rid of the human and have when you're driving along, are you going to get an automated thing that says it's time to brake now, or are we actually, or might brake for you, or are we just going to
We already have that in Tesla.
Right. The Tesla brakes when it wants to, which may not be relevant for you, but may be scary for the passengers that are in the car. But or are you going to do the Waymo thing, or what Elon Musk says Tesla's do, and just get rid of the driver, right? And have it itself. So you guys just did a survey about the sort of the use of AI and survey consumers about this in healthcare. Give me a sense about where you think we are with the quote unquote replacement or the augmentation of the customer service aspect with AI, and what was the findings of the survey? What do people think about it?
Yeah. I think that well, there was a couple really interesting pieces. One was, I think most people feel like the patient experience is getting worse.
Yep.
Not better. I think that there's an interesting piece of optimism, but at the same time, not in clinical. Like nobody really wants an automated physician and clinical work in discussions there, but they feel like maybe there's some interest in helping reduce the administrative burden that's out there right now. Because in reality, what's happening is there's just long wait times for everything.
Yeah.
Now, will there still be long wait times with just less humans, or are we going to actually reduce the wait time? Has yet to be seen. I think the complexity that we've built in inherently to healthcare is going to preclude us just getting rid of people. But I think it's going to hopefully help reduce the burden that we've seen, because as we've gone through time here, especially in the last decade, the amount of legislative burden that we've placed on these organizations is humongous. So being able to take some of that off their plate so that they can get back to delivering care, I think is really, really important and central to where I think the initial uses of AI will come. And I think that that's what you're seeing in the survey. I did think it was really interesting that men are more optimistic than women about the use of AI.
I didn't notice. Well, I mean, I'm of the belief that actually there will be a significant amount of clinical care that will be replaced by AI. I think as soon as we get to, I mean, we're almost there in some aspects of mental health, particularly where we're using a lot of chat back and forth anyway. I was going to say Talkdesk, but you're Talkdesk. I'm thinking you're Talkspace, right? And some others. And then you have companies like Wobot and others who are doing, having literally a robot therapist do it for you. And I think if you look at a lot of the activity that happens in therapy, a lot of it is if you can get a human to have a connection with a computer, which you clearly can in many cases, it'll be as effective. And that's an area where we have massive shortages. When you want something in your pocket,
so many shortages.
Where you could use this minute or for 24/7 versus 6 to 8 to 12 to forever, to get a CS forever. So I think there are certain kind of areas where this will happen quickly. But I'm with you. I think more of it is going to be aimed at the more at the sort of the administrative layer, and can we figure out a computer to reschedule me without having to have a human? So that I think people.
How nice would that be? Yeah.
So I'm with you. I think it'll probably, come quicker, and the AI is still getting faster and better. But for now, it sounds to me that you're using your tools more to augment augment the agent, the live human agents before we get to the
Correct.
bot agents, right?
Yeah. I mean, you talked about rescheduling appointment. We've got an organization that's almost at 60% automation, full
Yeah.
containment of appointment scheduling, which is amazing, right?
And
So,
by the way, what are the numbers? We'll go back to the modalities for a second. What are the numbers between people calling in versus, texting or IM or or using a website? What's you have to have an omnipresence, but what are the ones that are actually getting used the most?
well, you're still going to predominantly be in healthcare voice, right?
Okay.
I mean, voice and computer, right? Going in through a portal, whether it's a patient portal that they have, a provider portal that people are going in to look at, where's my payments, where's my prior authorization. There's going to be probably a good split between the digital, which everybody's going to push people to for first line, and then into the voice. Those are predominantly the biggest ones. There's still a large amount of faxing that goes back and forth.
Well, there was that. Yep.
It's amazing to me still. I can't tell you how many times I get asked for OCR vendors so that they can, parse the texts and things like that. So it's still a thing. And because it's secure, right? It's a secure method of sending information. Text is not HIPAA secure, email is not HIPAA secure, regardless of what it's actually pretty shocking. I have conversations with providers that are like, just send lab results in an email. And I'm like, that's not secure. Do you have a portal? And just the lack of kind of in general knowledge that folks have of what is HIPAA compliant and what isn't, still can be a little bit mind boggling, because it doesn't matter how much I can, as a provider of these areas, can say they're secure. They are not going to be HIPAA compliant because they involve a third party that it sits on their server. So, understanding all of those different things, we have so much more, such a highly regulated industry with data privacy and all of those things, that there's really only certain channels that you can have conversations on that are secure. You can go off of them and say, okay, we're going to do this, but you have to understand this is not a HIPAA compliant platform, and you have to sign off that you're okay with having the conversation over here. So that is some choices that organizations make. But there's a lot. I think most things are going to still predominantly be voice, and like I said, the portals. There's a lot of text reminders and things like that happen as well for appointment scheduling and things like that. But beyond just a confirm or cancel, that's still pretty nascent. Like the ability to do a text chat is still, especially with a bot, is very, and even with a human, is very small.
Right. So, I think what you're saying is fair enough, right? We're making the current infrastructure better. We're not quite changing the paradigm of how people do this yet. And I suspect that we'll be working on that for some time to come.
I agree.
But let me ask you sort of a deeper philosophical question. And we're in a period of time where we have a shortage of providers. Most providers are pretty busy. Most physicians and clinicians are pretty busy. Most provider organizations are kind of doing okay in terms of financially. Some of them are doing super well at the moment. How much interest from, and as your survey showed, we have 62% of consumers are pretty pissed off with how they're treated by the system. Is there actually any real interest in the system, in the people you work for, in making this much better? How important is a Talkdesk and improving this situation with the consumers to the
it's a really
objectives of the companies you're working for?
So here's the interesting thing about working in healthcare that's different from other verticals, right? If you think about banking, retail, et cetera, their central tenet is consumer experience, right? Because that's a big piece of what they're trying to accomplish. When you think about the central tenet of healthcare, especially the provider organizations, it's clinical care. It's high quality clinical care. So once you're in the four walls of those hospitals, you tend, or in the physician offices, you tend to get really good care. We can debate the variety.
There's a lot of debate about that, but I get they have you there for the clinical care.
Their focus is on that even when I first started talking about patient experience, and I would go to a patient experience conference, it was all about inside the four walls of the hospital and how that experience was. That's what they were measuring. There was no measurement of what happened in the I'll call it the consumer side of the thing. And nor was there a big focus on it in most organizations, right? It was, we want to just make sure that the phones are working and that, we're doing our best, but this is just where we are, especially it was the pandemic. So there was a lot of that too. But today, I think that as we start to, and I just saw the list, I think the Becker's put out of operating margins for the top 20 health systems. And I don't know if you saw it, Matt, but I was appalled. Like 4 or 5 are making money.
Oh, I actually, yeah, but they do okay. Very few of them are losing a lot of money, and some of them making a lot of money.
Operating margins, and some of these guys are like minus 20%. These were not small losses. So when you think about those things, and we can debate whether those are true or not. I'm just taking them as face value, right? If I just look at them and you say, wow, that's a problem for our country, right? So how do we start thinking differently about when we look at those contact centers and we just think of them as cost centers, and we don't do anything about the things that can help us with our revenue and with our, there's so many different things that we can do there that we're not doing today to drive the revenue forward. And I'm not talking about, hey, I want to sell you an MRI. This is about like making sure that folks are doing the things they need to do to stay healthy, which also hits our value-based care contracts and then reimburses us at a higher level and things like that. Those are all really important and very things that you can draw a direct correlation to improve your revenue situation that we're not doing.
Yeah, no, I say I'm what you're saying, and you can argue back and forth on how well they're doing, but there's no question that you could both improve efficiency and also steer patients in a much more effective way, which eventually can lead to them either getting more services or higher quality scores or whatever, which does impact the bottom line. And we could be done better. So I'll grant you that. We can argue about whether HCA making 18%.
They were, by the way, in the double-digit positive.
Oh, so. There's a bunch of people in double digits, and there's a bunch of people who are hiding the rest of the money very well. But we can discuss that one. When you have local systems paying their executives more than the local baseball team pays their players, we can argue back. Having said that, I think from the consumer point of view and from the system point of view, it can be done a lot better. So you're in the right place for that. All right, let's talk really briefly about Talkdesk or the health section of the company. Give me a sort of scale of how big you guys are within healthcare. Predominant, you mentioned Epic and providers, but prominent client base. How do you measure yourself in terms of what you're doing and what are you coming up with that's the next big thing?
Yeah, so we're the largest vertical inside of Talkdesk. When I started 4 years ago, we had some providers, we had some payers, but it was certainly not to the level that it is today. I think that just speaks to the innovation and the thought process.
Do you have a number for how many provider systems you have on?
I don't have all the numbers in front of me, Matt, but we've definitely got dozens, and we are growing exponentially every year, which is really nice. It's the where we're going next is a lot of the stuff that I kind of talked about, right? The AI piece is huge because it drives all of that time that you can give back to the agents so that when they are talking to the patients, they're having higher level, more value-driven conversations that have value both to the patient and to the organization in general. And by the way, that also goes for the payers, right? We want them doing the same thing, right? They don't want to have to, hey, where's my prior authorization? They should be able to get that answer pretty easily through a bot. Is my prior authorization approved yet? Yes or no? Great. That's all I'm looking for. It's approved. Good. I can go now do my thing. If it's, a physician calling in to find out where their payments are for various patients, we want to automate those things so that they have more time to speak to the members, right? That's typically something that they want to do in a big way in the payer world that we work in. Life sciences is looking at patient access in a way that's really interesting too, because they're all about how can we help patients afford their medications, right? And then how do we get more patients into clinical trials in ways that maybe we didn't have reach to the broad pool, which caused some bias, right, in these clinical trials. So how do we increase the pool sizes, look across these sectors? How do we help automate some of these things? So all those things are really interesting things. I come from the research background. So for me, that's the fun stuff, right? Is how can we really look at working really closely with these organizations who are really thinking outside the box and come up with ways to enhance how they're engaging with patients, consumers, physicians, et cetera. So that's really what we've been focusing on, versus just kind of standard contact center aspects. I have a whole group that does that inside of Talkdesk. I tend to play a little bit more in the, what can we do next and where can we go?
Yeah, and what problems can we solve? And you mentioned life sciences as well as the clinical trials and patient access programs. That's that plus plans and providers is your focus. Roughly, how does your business split between those four segments now?
Yeah, more heavily provider at the moment, payer pretty good size, and life sciences we've got some big players that have made some bets with us that are real excited about some things that they're rolling out. So I see that coming on pretty strongly here in the next year.
And half of those guys are starting to think that they're actually selling drugs directly now. So we'll see how that plays.
Well, there's a lot of specialty pharmacy as well.
Right, brilliant. All right, I've been talking with Patty Hayward. She is the general manager of general manager of healthcare and life sciences for Talkdesk. Patty, thanks for your time. Nice catching up with you, and good to find out what it is you do in the background there.
Yes, thanks, Matt, for having me. Appreciate it.